I'm sorry that I'm going on about this, but it's such an important point that your goal here in dealing with your OCD cannot be to stop the thoughts, because it doesn't work. It's impossible and you will never achieve it. And the more you try and achieve it, the more you will keep focusing on the problem and the problematic thoughts, and the worse it's going to feel. So what we're going to do in some more of these videos is I'm going to exemplify this in some of the other thought videos, and we're going to start showing you some training exercises as well for how to just let the thoughts be there and observe them without engaging in them. But just so I'm not leaving you with anything, I want you to think about starting to think about those thoughts in a different way. So when they come into your head, rather than trying to get rid of them or erase them or act on them, just try and see if you can notice them without attaching importance or appraising them anyway. Notice them and just let them be there and let them pass. So if you imagine, for example, that you're standing on a busy train platform and there's trains coming and going, imagine your thought is like a train. You can watch it come into the platform and you can watch it leave. You don't have to get on board that train. And even if you do get on board that train, you can decide to get off again. So we want to start thinking about you are the person who gets to decide whether or not you think about the thoughts. You get to decide whether you board the train, okay? So it's about them coming and going, letting them, you can watch them come in, watch them go out without engaging on them. So they become just like passing traffic on a motorway. Okay, some people like the idea of thinking of them as the sort of leaves and twigs and things that are floating down a river. And you just watch it float on by. You're not wading into the river and trying to pull this stuff out. It's just there. And that's how we want to get you to start thinking about this. You can't control them. You can't control whether or not it comes into your mind, but you can control what you decide to do with it then.
You and good afternoon. This is Sam Vaughn for Sam's Sports Report and Sam's Mental Health Day. Today we're going to go over OCD. This should be part 9. Obsessive compulsive disorder is a common OCD mental health condition where person obsesses over thoughts or compulsive behaviors. OCD can affect men and women. Some people start having symptoms early, often around puberty, but it usually starts during early adulthood. OCD is a distressing and significantly interfering with your life, but treatment can help. You can keep it under control. Much like all mental health problems, you will need to take your meds. Obsessive compulsive disorder, OCD. If you have an OCD, you'll usually experience frequent obsessive thoughts and compulsive behaviors. An obsession is unwanted thoughts or unpleasant thought or image or urge reportedly enters your mind and feeling anxiety or disagrees. A compulsion is a relatively behavior mental act feel your need to temporarily relieve the unreasonable brought by the obsessions. For example, someone with obsessive fear or being burgled may feel they need to check all the windows, doors, and locked several times before they leave the house. Women sometimes can have OCD after is born, obsession, not sterilizing bottles properly. Compulsion could be things such as repeatedly checking if the baby is breathing. One thing a person does that OCD may hand wash a lot. They also check for doors and if they are locked. Getting obsessive compulsive disorder, people with OCD are often reluctant to seek help because they feel ashamed or embarrassed. It's a health condition like any other. Nothing to feel ashamed or embarrassed about. Having OCD doesn't mean you're mad and it's your fault. The 3 main ways to get help: see a psychiatrist, to see what the problem is, to diagnose you if you have OCD, refer to your directly NHS services, NHS talking therapists or services in your area, see a GP. Symptoms can refer to local therapy services if necessary. If you think a family member has OCD, try talking to them about your concern and suggesting them to get help. It is unlikely that OCD will get better without treatment or support. Treatments of compulsive disorder: there are some effective of OCD. The main treatments are talking therapy, usually cognitive behavioral therapy, which faces your fears and obsessions, thoughts without putting them through the compulsion. Medicine is usually type of antidepressants called selective serotonin reputates, inhibit SSRI, which helps balance the chemicals in the brain. CBT usually has quite quickly. It can take several months, but before you notice the effective treatments, most people will eventually benefit. If here some treatments do not help, you'll be offered SSRI or be given a combination of SSRI and CBT. Some people refer to mental health service for their treatment. Causes of OCD: it's not clear. OCD is a number of different factors, but including a family history. You're more likely to develop a family has it probably different brains. Some area of the brain's unusual high activity. Their brain link event, common builders, negligent, sometimes important life events, personal mucus, medicine, high personal standards, living with OCD, difficulty it might find, helps to contact support or giving OCD information or advice. The following websites may be useful for support. Here are them, and here are them in the link. Here are them, here are they in a link. If you copy this web page and look these up and then click on the one you want, they will upload something about information. Information on Selective Support Guide. The Selective Support Guide has advice about where you can get support. You need help need help day to day because of your illness, disability. Care for someone regularly because they're elderly or disabled, including family members. More on obsessive compulsive disorder overview, OCD, obsessive compulsive disorder symptoms, obsessive compulsive disorder treatments, obsessive compulsive disorder. Same thing, click the links and they're above. This is Sam Vaughn for Sam's Sports Report and Sam's Mental Health.